Welcome to the second episode of Dr. Lukman's Perspective. I am your host, Salihu Lukman. Our topic for today is: do you want to stop taking diabetic medications? How best to manage type 2 diabetes using lifestyle enhancement alone. If you may recall, in episode 1, I mentioned that I was diagnosed with diabetes in 2015, and I fought it to a standstill in just 15 months. As a disclaimer, I am not a medical doctor. I am a civil engineer by professional practice who specialize in environmental engineering. But I had to look inward when I was diagnosed with diabetes. I have to weigh all the available options. At the beginning, I started with medications. Just a month later, I was also put on insulin for 2 months, experienced episodes of hypoglycemia. The insulin was stopped, and then I continued with medication until one day when my blood glucose level was fluctuating between hypoglycemia and hyperglycemia during the fasting period. And then I decided to stop fasting, stop the medication, and change my diet completely to one that is nutritious, to one that I know will not raise my blood sugar level. And that was how it all started. And that was the last time I took diabetic medication in 2016. And up till now, I don't take any. I have written a long article on that. If you want to read it, you can check it online or on my website. The title of the article is How I Fought Diabetes in just 15, How I Fought Diabetes to a Standstill in just 15 months. I wanted to share my experience with others to see how other diabetics can be weaned off medication, and to share my experience in the management of diabetes. One thing I realized that is most significant is weight loss. Weight loss is the most important aspect for diabetes reversal and effective management. When I was diagnosed with diabetes, I weighed 86. As I'm talking to you now, I weigh 73.5. And the two aspects for weight loss are diet and workout. You have to get your diet right. And first thing first, you need to identify healthy food options around you. And knowledge, as they say, is power. You have to read about different nutritious diabetic meals and come up with your personalized meal timetable. I said personalized here because what is good for the goose may not be always good for the gander. My meal plan may not suit you, or my food items may not be available around you. Hence, the key here is having a thorough understanding of the different nutritious meals and then narrowing them down to a personalized meal plan based on two factors: availability and affordability. Secondly, effective monitoring of daily glucose levels cannot be overemphasized, because it is the only way through which you will know whether your meal plan is the right one. Are you experiencing episodes of hypoglycemia or hyperglycemia before or after meal? Then definitely you need to revise your meal plan accordingly to avoid these episodes. Remember, hypoglycemia, as the medical doctors would tell you, is more devastating. So avoid it as much as possible. And when planning your diet, you have to plan your breakfast very well because it is the most important meal of the day. As the nutritionists and dietitians would tell you, it should consist of high protein, high fat, but low carbohydrate. And dinner should be as light as possible. Fruits may suffice. Never allow yourself to go hungry. This is very important to avoid hypoglycemia. And to do that, you need to be snacking between meals with fruits, nuts, or vegetables, and drink an adequate amount of water to stay hydrated. That is on diet. The second important aspect of weight loss is exercise or workout. You have to have a regular schedule of low intensity workout, such as brisk walk for at least 30 minutes, and also for at least 5 days in a week. Brisk walk suffices because high intensity exercise may accumulate muscle mass, which will lead to weight gain. But know that even without exercise, you can still lose weight as long as you get your diet right. And remember, you are what you eat. If you eat nutritious meal, you live healthy. If you eat junk food, then you will always be unhealthy. And another aspect that is also very important is regular monitoring. Here we recommend 6-point tests, because without proper monitoring of your glucose level, like I mentioned earlier, you will not know whether your diet or your personalized meal plan is the right one. And the 6-point test here are as follows. First is the fasting. Just before your breakfast, 2 hours after your breakfast, just before your lunch, 2 hours after lunch, just before dinner, and 2 hours after dinner. The test before the meal will tell you whether you have low blood sugar, which is hypoglycemia. And the tests after meal, 2 hours after meal, will tell you whether that food is the right one, because your sugar level, if it is within the normal range, then you are safe. Otherwise, you need to revise your meal accordingly. The 6-point test will help you answer questions such as, am I eating the right diabetic meal? Am I having hypoglycemia or hyperglycemia? Is there a need to increase or decrease the dose of my medication or wean me off completely? Another part of effective monitoring, in addition to the 6-point test, is the hemoglobin A1C test or the HbA1c test, which gives the average glucose level in the past 2 to 3 months. It is recommended that you take it every 3 months in addition to the 6-point test. Of course, you stop the 6-point test when the target range is reached. You don't stop completely, but you can reduce the frequency. Rather than 6 points, you can reduce it to just 2 points or even 1. The fasting blood sugar level. HbA1c is very important on diagnosis. When you are diagnosed with diabetes, run HbA1c test to see your starting point. And then 3 months into your treatment, Repeat the test again to see how effective your treatment has been. Of course, if your 6-point tests have been within the normal range, definitely there is no way, no how your HbA1c level will be high. There are other tests, most especially for the elderly, like kidney function, eye function, heart function, and all that may need to be undertaken probably on annual basis, because diabetes affect some vital organs in our bodies. As I mentioned earlier in my previous episode, I created 4 groups titled Diabetic Monitoring Forum 1, 2, 3, 4. 2 of these groups are in Hausa, one on WhatsApp and the other on Telegram, called Ciwon Sugar. The other 2 are in English on WhatsApp and the other one on Telegram, called Diabetic Monitoring Forum, DMF. This forum was formed with the sole intention of passing on this message that you can actually reverse type 2 diabetes by changing your lifestyle, getting your diet right, doing workout, and in this we have 3 membership classes. The first one, ordinary membership. Anyone that joins the group, for now the WhatsApp group have been closed because on WhatsApp you cannot read previous messages, while on Telegram you can. So you can only join the Telegram groups so that you can read all the previous discussions, presentations, Q&A sessions, for you to be upgraded to the level of the members. So ordinary membership entails that you join the group and then you can participate during discussions, ask questions, and read all the articles that have been shared as well as the presentations on the forum. The second category is special membership, in which one has to fill a special membership form, which is a pro forma that gathers your history, your medical history, as well as your various food choices, for us to look at those choices, analyze them appropriately, and advise you accordingly. The third category, which has been frozen for now, is the premium membership. We realize that some of those who applied for the special membership are not filling the forms correctly. They do not spend time and understand that whatever they fill has to be legible and accurate. So we felt coming up with a premium membership will make people become more serious. But then because of time factor on my side, I suspended the premium membership for now. And to this end, we have achieved so many success stories. We have weaned a lot of diabetics off medication, while others who were hitherto having poor management of their blood sugar levels attained good and effective management level. Getting your diet right is everything in diabetes management. You have to get your diet right as long as you want to be weaned off medication. And once you get it right, your blood sugar level will stabilize within the normal ranges, and then you can be taken off medication and you will feel better. To this end, I would like to appreciate those that have been helping me day and night to run the different diabetic monitoring fora. First on the list is my darling wife, without whose support I wouldn't have achieved much in this regards. Then I would like to appreciate all the efforts of Dr. Umar Yahya Lukman, as well as Professor Hajara Ibrahim. I will not forget the input of Dr. Muhammad Manko, as well as Dr. Hamad Sani, together with Dr. Abu Bakr Hassan. All these I mentioned are either medical doctors or a pharmacist. All these I mentioned are medical doctors, except one who is a pharmacist. We also have the last but not the least, the food basket of DMF, Asia Jamu, who prepare all the food that we need, the healthy, nutritious, diabetic meals that one can rely upon. And she can ship it to your location, wherever you live, so that you won't have any excuse not to take the right diabetic meal whatsoever. Thank you so much.